Hello everyone. Today I have come with an information on cancer and its treatment modalities. So when we talk about cancer, what exactly this cancer means? It is a disease where there is a rapid multiplications of cells taking place in the body, and it is presented in the form of a mass or else a lump. And this mass can be palpable, may not be palpable. So in case if the person is suspected to be having a cancer, we need to go for a proper investigative diagnostic method to rule out the stage of the person as well. Then what do you mean by stage? Whenever any person is suffering from cancer, the first thing that click in our mind is at what stage the person is presenting. Is it a curable stage or else it is a palliative stage. Curable means there is a hope that this cancer will be cured and the person can live a cancer free life, whereas palliative means it is a stage where the person this disease will not be cured, but we can add quality to the life of the patient and also can treat the cancer to some extent. Then what do you mean by staging? Staging, the tool that we use is the TNM staging. T stands for the tumor. That is the size of the tumor which is present in your body, in the person's body. And then next is the N. N stands for the node. That is the involvement of the lymph node, whether the lymph node are also having these cancer cells. Next is the metastasis. That means the spreading of the cancer in the body. The origin is something, for example, the origin is a breast cancer and the cancer has been spreaded to the lungs, liver, brain, etc. So TNM staging is the tool that we use to rule out the correct stage of the person so that we can give the right combination of the treatment. That means, what do you mean by combination? Combination means there are three treatment modalities in cancer. The first one is the surgery, second is the chemotherapy, next is the radiation therapy. So same person may have two person with same disease may have different treatment modalities. Like the person may have only surgery and may not have chemotherapy, may not have radiation therapy because not required. Some person may have chemotherapy, radiation therapy and may also go for surgery. Sometimes the person may advise for the radiation therapy followed by surgery, then followed by chemotherapy. Sometimes chemotherapy first, then radiation therapy. So it all depends upon the TNM staging. So it is very much important. So you need to ask your consultant, what is my TNM staging, at what stage am I present, my disease is presenting, am I in a curable stage or else in a palliative stage. So these are the three treatment modalities, dear friend. Next video I will be coming up with an information on what exactly this chemotherapy is and how can we cope up with the chemotherapy, and then what are the signs and symptoms that you may experience during chemotherapy and how can we deal with that. So in my next video I'll be coming with those information and some other cancer related information. So stay connected and thanks for supporting me. Thanks a lot.